How to fill up NEWS2 chart in OSCE assessment.
In the updated OSCE, we are using the NEWS2 chart for determining the degree of illness of a patient and respond to the clinical deterioration of patients as early as possible. Let us start from the full name, date of birth and date of admission of the patient. Usually, this shall be pre-filled for your exam. Then fill up the date and time as per the assessment scenario. Date, day/month, not required to write the year. Time, 24-hour format. NEWS2 comprise 6 physiological factors: respiration, oxygen saturation, blood pressure, pulse, consciousness, temperature. The candidates are required to put the values in the respective column corresponding to the patient's vital signs. Respiration: if the patient is having a respiratory rate of 18 breaths per minute, then write the value 18 corresponding to the columns 18 to 20, which gives a score of 0. Oxygen saturation: use only scale 1 for OSCE. If the O2 saturation is 98%, then write the value 98 in the column corresponding to greater than or equal to 96, and that gives a score of 0. Next comes the section for air/oxygen. If the patient is in room air, put A in the respective column. Oxygen therapy: write how many liters of oxygen is on flow. Nasal cannula: write NC. Venturi mask: write VM. The score is 2 for highlighted ones. Blood pressure: chart both systolic and diastolic blood pressure using a dotted line joined by double-end arrows. Then take only the systolic blood pressure to get the score. For example, in case of 130/90 mmHg, the score will be 0. Pulse: if the patient is having a pulse rate of 74 beats/minute, then write the value corresponding to the columns 71 to 80, which gives a score of 0. Consciousness: we have options such as alert, confusion, voice, pain, and unresponsive. If a patient is alert, write A or even put a dot. Temperature: if the patient is having a temperature of 37.8, then write the value corresponding to the columns 37.1 to 38, which gives a score of 0. Now, add all the scores and write the total score down. The monitoring frequency and escalation of care depend on the NEWS score. State whether escalation is required by putting Y or N and put the initial of the candidate. This is all about the NEWS2 chart.
More updates are on the way. Like, subscribe, and turn on notifications for the latest updates on the syllabus and materials on OSCE. Stay tuned for insightful videos.